said before, I mean, in my practice, sometimes people come see me as a last resort. They would be like, I don't really believe in acupuncture and what you're doing, but I can't find anything else. That would happen all the time. And, people would come to see me, for example, with severe migraines, and they would be on like 5 different medications, one for the pain and the nausea and so on and so forth. And it turned into this cycle that I would see all the time, because they started taking all these medications that tax their liver. And the liver in Chinese medicine, right, a lot of times is related to migraines. And so their migraines would get worse, and they just keep having to take more medication. And the cool thing is that you can get people off the medication by changing their diet and doing things like acupuncture. But I'm so interested from your point of view, because so many people are stuck in this rut, and they go to the doctor, and the doctor just, has medications to give rather than this prevention. So what's your experience with that? I'm so curious.
Yeah, absolutely. I mean, I see the same exact thing. And then not only that, but there's side effects that are being caused by the medications, and there's very specific nutrients that get depleted by the way some of these medications work. I mean, it's just a terrible cycle. So my experience is this. I knew ahead of time before going to med school that nutrition was the foundation of health. And so took some things in med school with a grain of salt. What you get taught is how to classify symptoms into a diagnosis, and then which drugs are, appropriate for that diagnosis. And I think a lot of people don't realize that the way that the recommendations come about in conventional medicine, Western medicine, is from evidence. They call it evidence-based medicine, that comes from medical literature or studies that are oftentimes funded by pharmaceutical companies, if not almost always. And then not only that, but a lot of the results that get reported are only the results that they want to be reported. And anything that doesn't actually prove their point is dumped and never published. And so then that gets passed down. It goes to whoever, the powers that be that decide, this is the new standard of care. And, for migraines, we're going to use this medication first, and then this one, and then this one, and, exhausting all options. And then it gets more and more complex as they try to find a way to resolve something that, for many people is food related, is lifestyle related, is some, habit that they're doing or not doing that's perpetuating that cycle.
And most people are not doing studies on food cures, or they're not doing studies on lifestyle, because there's no money to be made from that.
Right. There's no money to be made from that, and there's no money to put into it because the studies are also very expensive.
Yeah. And I've heard, and with the pharmaceuticals funding the medical schools, it's kind of like a conflict of interest that shouldn't really be happening. But it seems like it's really kind of taken over our medical system, and people are indoctrinated into this way of thinking that doesn't really empower the patient.
Right.
It's just, and I know there's so many amazing doctors out there, and I'm sure they would love to have more tools, but you also get in trouble, right? Sometimes if you go against the standard of care.
Right. I mean, I kind of think about the whole field of medicine is a little bit of a hazing process. So they want to select for people that are going to learn well and sort of take their recommendations and then deliver them. And what I've actually observed, I have a lot of amazing colleagues in medicine, but I also see a lot of fear of going outside the box or just not having any other options. And so there's just a real attachment to continuing to practice in that way. Never mind that most of our system is overwhelmed with just too many patients. So doctors are seeing 5 patients in an hour, maybe more than that, right? And how do you do anything that's actually focused on reversing disease or implementing lifestyle changes when you only have a few minutes?
Yeah, I mean, our medical system is really needs to be transformed on some level.
Yeah.
And I think that this is such good information because, people just need to know that when you go to the doctor, not to not take their recommendations, but you are in charge of your own body. And so going and doing research on the medications you're prescribed and doing the research on potential alternative treatments can only empower you. It's your body, and you have the right to make the choices that you want to make for your health. And we, when we did our podcast together, we were talking about breast cancer. And, it's so interesting in terms of the standard of care on that level.
Right.
Where, I mean, I know, practicing Chinese medicine, it would be illegal for me to to treat somebody with cancer. I mean, I could treat the side effects of chemotherapy and nausea and energy and all of that kind of stuff. But in the state of California, it's actually illegal to try to help somebody with that. So our standard of care is so tight and stringent. It's very difficult to go out of the box. And there are a lot of alternative treatments, that have come out. And there's a lot of people doing alternative treatments. But it is, for doctors to do that, it's a very scary thing because you're going against what you were just talking about.
Going against the establishment. For some things, there's a fear of losing your license. And after doctors put so much time into their training, the last thing that they want to risk is their livelihood and their investment and and the sacrifice that they made to do all of this training. I'm interested in that, that whole story changing, and with the work that I do is really all focused on empowering the patient. I love it when people have done their research, read things, listened to podcasts, and can ask questions where they're informed, and I can help fill in the gaps that way.
That's so great. Your patients are so lucky to have somebody like you with your background.
I feel lucky that I get to be in service with them.
Yeah,
too.
it's so great. So the message with this little part of our video is really just to make informed decisions, and it's your body, and do your research.
Do your research, and then also know that if you are seeking the help of a conventionally trained physician, their tools are limited, not even because necessarily that they want it to be that way, but that's just the system that they're in, and know that doesn't mean that something else isn't available. It's just that those are just their limitations.